Every year, more than 3 million people experience some form of sciatica. Dr. Gregg Silverman joins us right now with
And you should know about it.
I know firsthand. I've talked about it plenty if you've followed the show for a couple years. I've had 2 reconstructive back surgeries, and they've all stemmed from different things, but you get that pain from the sciatic nerve.
Correct. The sciatic nerve is a nerve that goes down from your lumbar spine, down behind your hip, and into the back of your thigh, basically, and that's where the pain radiates. The pain can radiate from, and you can see here's a good picture of that, your sciatic nerve pain. You can have anything from the back, from the buttocks to the hip to the back of your thigh, and sometimes even into your calves.
One of the things that always helped relieve that, and we'll get to this in a second though, but it's like driving an elbow into that, to the buttock there, as you mentioned, kind of gives some temporary relief. But the pain that you feel, it's shooting, it's electric, it's tingling. There's so many different adjectives, and doctors want to know every single one of them.
Right. Well, that's the question is you know, and the not just the intensity, but how did it come on? Did it come on all at once? Did it come on off after an automobile wreck? Did it come on after you did a certain thing? What made it better? At what points in the day was it better? You know, did anything certainly make it worse?
I was doing kettlebell lifts.
Yeah.
And I was thrusting like you're supposed to, and it just, I felt it tweak, and I was like, there it goes.
Boink, and then all of a sudden there's radiation down your leg. And so those are the kind of things that we're looking for as far as, you know, is this sciatica, does this need to go a little bit further? Is physical therapy just the right thing to do at this point? Or does it need to be, do we need to be a little bit more aggressive, right? And the times when you are more aggressive is if you ever lose feeling or sensation, or you cannot, or lose motion in your leg, if you have problems with controlling your bowel or bladder, if it's intractable pain, the kind of pain that you just can't tolerate anymore, that's the kind of stuff.
That's where I was. I never had the bowel or having to go to the restroom or anything like that. But definitely talk with your doctor.
Right, at those points. Most of the time these generally go away with rest and non-steroidal anti-inflammatory type of drugs. Most of the time, and exercise and some sort of physical therapy. That's the general treatment. It's very rare that it has to go on to surgery at that point. If there's muscle damage, if there's nerve damage, those are the times when we start thinking about this.
Dr. Silverman, thank you, sir. We appreciate you.
Well, thank you very much.